Picture this. A 72-year-old man named Robert has been taking his blood pressure pill every morning for years. His numbers look good. His doctor says everything is controlled. But Robert does not feel controlled. He feels tired before lunch. When he stands up from the couch, the room tilts. His ankles look swollen by evening. And every time he tells someone, the answer is the same. You're just getting older. But what if it is not just age? What if the thing that looks like aging is actually your body trying to tell you something about your medication? Today we are talking about 3 of the most common blood pressure medicines: Amlodipine, Losartan, and Lisinopril. Let me be very clear before we go further. These medicines can protect the heart, kidneys, brain, and blood vessels. They help prevent strokes and heart attacks. This video is not telling you to stop them. Never stop, skip, or change your blood pressure medication without speaking to your doctor. But after 65, your body changes. Your kidneys may not clear medicines the same way. You may be taking more than one prescription. You may also be using supplements, pain relievers, or over-the-counter medicines that change how your blood pressure pill works. And that is where the danger begins. Because sometimes the medicine is doing its job on paper, but your body is paying a price in real life. So today I want to walk you through 6 silent signs that people over 65 should never ignore if they take Amlodipine, Losartan, Lisinopril, or any blood pressure medication. Stay with me until number 5, because that one is the sign many people confuse with normal aging, even though it can lead to falls, injuries, and hospital visits. Number 1. Dizziness when you stand up. This is one of the most important warning signs. You sit on the edge of the bed. You stand up. For 2 or 3 seconds, the room feels unstable. Maybe your vision gets dark. Maybe you reach for the wall. Maybe you tell yourself, I got up too fast. Sometimes that is true. But if it keeps happening, do not ignore it. Blood pressure medicines are designed to lower pressure inside your blood vessels. But if the pressure drops too much when you stand, your brain may not get enough blood flow for a few seconds. That can cause dizziness, lightheadedness, weakness, or even fainting. This is especially important after 65 because falls are not small events. A fall can mean a broken hip, surgery, long recovery, loss of independence, or fear of walking alone. Here is what I want you to ask your doctor. Can you check my blood pressure while I am sitting and again while I am standing? That one simple check can reveal something a normal seated blood pressure reading may miss. And remember, the best blood pressure number is not always the lowest number. The best number is the one that protects your heart without stealing your balance. Number 2. Swelling in the ankles or feet. This is especially common with amlodipine, which is a calcium channel blocker. Amlodipine works by relaxing blood vessels so blood can flow with less pressure. That is useful. But in some people, especially older adults, it can also lead to fluid collecting around the ankles and feet. Many people are told, that is common, don't worry. But common does not always mean harmless. If your ankles are swelling so much that your shoes feel tight, your socks leave deep marks, or you avoid walking because your legs feel heavy, that deserves attention. The swelling may be a medication side effect. It may also be related to circulation, kidney function, heart function, or another medical issue. The point is this: do not simply accept it as normal aging. Ask your doctor, could my swelling be related to my blood pressure medication? And do we need to review my dose or medication class? Do not stop the pill on your own, but do not stay silent either. Number 3. A dry cough that will not go away. This one is strongly connected with Lisinopril and other ACE inhibitors. A person starts Lisinopril. A few weeks or months later, they develop a dry cough. No mucus, no fever, no clear cold, just a tickle in the throat that keeps coming back. They try cough syrup. They change pillows. They blame allergies. Some even worry something is wrong with their lungs. But sometimes the answer is sitting quietly in the medicine cabinet. ACE inhibitors can cause a persistent dry cough in some people. It happens because of how the medicine affects certain chemicals in the body that can irritate the airways. If you started coughing after beginning Lisinopril, or if your cough has no clear explanation, ask your doctor, could this cough be related to my ACE inhibitor? There may be alternatives, such as an ARB like Losartan, but that decision must be made by your healthcare provider. A cough may sound small, but in older adults it can interrupt sleep, cause fatigue, trigger dizziness, and reduce quality of life. If it has been going on for weeks, it deserves a conversation. Number 4. Unusual weakness, fatigue, or brain fog. This is the sign many people dismiss first. They say, "I'm tired because I'm older." But sudden or worsening fatigue is not something to ignore. Blood pressure that is too low can make you feel drained. Medication interactions can make you feel foggy. Kidney function changes can affect how medicine builds up in the body. And electrolyte problems, such as high potassium, can sometimes cause weakness or unusual tiredness. This matters for people taking Losartan or Lisinopril because both can affect potassium levels and kidney function in some patients. Many people do not feel symptoms when potassium is rising, which is why blood tests matter. Here is the key question. When was my kidney function and potassium last checked? If you take Losartan, Lisinopril, or similar medicines, your doctor may want periodic blood tests. This is especially important if you also take potassium supplements, salt substitutes, certain water pills, or some pain medicines. And please listen carefully. Do not start potassium supplements just because you heard potassium is good for the heart. For some people on these medications, too much potassium can be dangerous. Number 5. Feeling worse even when your numbers look perfect. This is the one I really want you to remember. A blood pressure reading can look beautiful on paper and still be wrong for the person living inside that body. Maybe the chart says 118/70. The nurse smiles. The doctor says, "Great control." But at home, you feel weak. You avoid stairs. You feel dizzy after meals. You are scared to shower alone. You stop walking outside because you do not trust your balance. That is not a small detail. That is the real outcome. Blood pressure treatment should protect your life, but it should also preserve your ability to live that life. For some older adults, especially those with fall history, frailty, kidney disease, or multiple medications, the target may need to be personalized. That does not mean high blood pressure is safe. It means your doctor should treat you as a whole person, not just a number. Ask this: is my blood pressure target still right for my age, fall risk, and overall health? That question can change the conversation. Number 6. Taking other medicines that quietly interfere. Blood pressure medicines do not live alone. They interact with the rest of your daily routine. Pain relievers like NSAIDs, some cold medicines, supplements, salt substitutes, water pills, and other prescriptions can all affect blood pressure, kidney function, potassium, dizziness, or swelling. This is why older adults should bring a full medication list to appointments, not just prescriptions. Include vitamins, herbal supplements, pain pills, sleep aids, and anything bought without a prescription. Ask your doctor or pharmacist, "Can you review everything I take and check for interactions with my blood pressure medicine?" This is one of the simplest safety steps, but many people never do it. Now let's bring it all together. If you take amlodipine, watch for ankle swelling, heaviness, dizziness, or changes in how easily you move. If you take lisinopril, pay attention to a dry cough, dizziness, weakness, and whether your kidney function and potassium are being monitored. If you take Losartan, remember that dizziness, potassium changes, and kidney monitoring still matter, even if the medicine feels easier to tolerate. But the biggest lesson is this: do not judge your treatment only by the number on the blood pressure machine. Ask how you feel, ask how you walk, ask how clearly you think. Ask whether you are falling, swelling, coughing, or losing energy. And most importantly, do not stop your medicine out of fear. Use this information to have a better conversation with your doctor. Here are the 5 questions to take to your next appointment. Why am I on this specific blood pressure medicine? What is my blood pressure when I stand up? Could my symptoms be related to my medication? When were my potassium and kidney function last checked? Is my blood pressure target still right for me at my age? A good doctor will not be offended by these questions. A good doctor will be glad you are paying attention. Because the goal is not just to lower a number. The goal is to help you stay strong, steady, clear-minded, and independent. If you take amlodipine, Losartan, Lisinopril, or another blood pressure medicine, tell me in the comments. Which one are you taking? And have you ever had dizziness, swelling, cough, or unusual fatigue? Your story may help someone else realize they are not alone. And if this video helped you understand your medication in a new way, subscribe for more senior health videos explained clearly, calmly, and without fear.